this client has had an Achilles tendon rupture, I do scar release. Or if you haven't done scar release, if you're just doing energetic work or massage or your FST, you'll be wanting to stretch the calf. But I'll show you as what I do with scar release is that I'll touch the scar and it might be really sensitive or they might not feel anything. And you'll just ask, what does that feel like? And he might reply that it's tender, that it's painful, that it's numb, that he doesn't feel anything. And then you can just simply ask, I wonder what that means. And it's the simple questions of how you're relating to it. Depending on his answers, you're going to be really curious and you'll see the restriction in his calf and his foot. His dorsiflexion might really increase, his plantar flexion might be more flexible. Always, as your modality would say, just keep testing. But not only are you testing in his mobility, but you're testing him emotionally. So always going back and forth and just tick-tocking through his physical feelings and his emotional feelings as well. When I first treated Dieter with his scar release, which was quite a big scar and it was very fibrous and it was very tender and it was very tight, when I combined the scar release with the advanced conversation, it was amazing. And I won't go into it, but it was amazing about what he was saying correlated to the feelings that were happening in his scar. And he used to feel very sensitive and you wouldn't be able to touch it. But now as I'm touching it, there's nothing. And the whole movement around the scar is so different to when I first touched it. So he's able to run now and he's able to do all the gym work that he used to do. You as a therapist have to really see where that tension is in the body and really ask some really curious questions. Be the investigator, be that therapist that is genuinely wanting to get the result for the client, because ultimately that's what you're doing the body work for, is to not only get them more flexible, get them in a rehab, get their body to move in a way that's correlated to their emotional feelings and their state of mind. Once you have that, you're going to get so much better results in your sessions. You'll get referrals, you'll get the clients to come back, and they won't know why you're actually coming back, but they want more of what you're doing. And I've had that many a time. I don't know what you did, Magdalena, but I want more of that. And when you do the course, there is so much more to add to not just asking the questions, but it's so much more into being the investigative therapist. You're adding so much more of a skill in being curious for the client to exceed all expectations of just being in a physical change.